and welcome to our live stream. I'm Dr. Deuk. Our patient is here with two degenerated, herniated spondylitic cervical discs, C5-6, C6-7. We talked about treatment, and one option was the standard cervical fusion, ACDF. Another option would be a posterior cervical laminectomy with or without fusion, and another option would be the shot cervical Deuk laser disc repair. We talked and I gave her a good chance that the cervical Deuk laser disc repair would work, well over 50%, and she chose the endoscopic Deuk laser disc repair. I don't blame her. I would have done the same thing. Cervical Deuk laser disc repair is a procedure where we don't have to do fusion. We don't have to put a cage. Now she has multiple allergies, so we're going to avoid iodine. You're not going to see on the x-ray the dye from the discogram. However, we still did a discogram because I need the blue dye. Are we broadcasting?
Yes, we are.
So this is our first broadcast for today. Is that correct?
Correct.
Yeah. And the reason is our other patients did not want broadcasting, so we respect their wishes. Okay, removing the needle on our first disc. Our first patient today was a lady from Singapore. We did 2 cervical discs, just like we are now, plus we did a Deuk plasma rhizotomy for facet pain. Just did it all in one procedure. She already went home. She is doing fantastic. And our other case was a lumbar Deuk plasma rhizotomy and ischial tuberosity injection for a hamstring pull. Shot. Patient had ripped their hamstring off their ischial tuberosity. Okay. 2 shows 2, 3, 4, 5, 6. Now, she has a combination of disc and osteophyte. I'm going to remove as much as I can, safely. We're never going to get all of it. The question is, can we get enough? Right? AP. I hope we can get enough. I expect to get enough. That's where the question on the surgery was. Is it going to work? Every patient is different. Every patient's chances of success are slightly different. All right, we're off a little bit to the left, so I'm going to correct that. Stay where you are. Help me, Luis.
Yes, sir.
Uh-huh. Nope. Shot. Lateral. I just moved us from being a little bit too far to the left back to the center. And sometimes if you're lucky, you get it perfect the first time. Shot. Remember, we're not going to see the dye from the discogram because we didn't use iodine. Shot. She's allergic. 2, 3, 4, 5, 6. Everyone agree we're at 5, 6. And I'm just inching my way forward. Not really inching, but more millimetering. So the first step here is to place this dilator, and then we're going to do the surgery through a 4mm external diameter tube. We use a laser. A laser is capable of vaporizing and removing herniated disc as well as bone spur. Remember, we're not here to make this disc look normal. We never will make this disc look normal. There's no surgery on earth that will make the disc look normal. Our goal here is to eliminate symptoms and give the patient hopefully a long-term solution. This procedure we're doing is FDA approved, peer-reviewed and published. We've been performing it for 18 years. Some patients have degenerated discs, some patients have herniated, most patients have both. All right, she is asleep under general anesthesia. So far, looking good. Almost done. I think that's about it. Maybe one more tap. For good measure, I think that looks great. Now she does have the little beak. We're going to get rid of some of that bone spur, but not all of it. That's for sure. Our goal really is primarily remove herniated disc, soft stuff. Because what's pressing on her nerves and spinal cord are a combination of hard and soft. We can get rid of the soft stuff easier than the hard stuff. Many surgeons don't get rid of either. They just go in and fuse, which is, in my opinion, not a good option for the patient. You want to do some decompression. Fusion doesn't solve compression issues, problems with neurological compression. Hey, Luis. I may have gotten some water in here.
Oh, you need to open it.
Oh yeah, there's tons of water in there. Oh, the water's here. Yeah, let's put a Raytech around it.
No problem, sir.
Here. Yep. All right. You said we're ready?
We ready, sir? Okay. Ready. Thank you.
Well, we're gonna, huh? I've already seen him. Didn't they tell you that? Did they? Yeah.
So we all doing it then, that's good, right? Yeah. Good. We're doing well with that today.
Yeah, all you ought to do is ask the nurse, did Dr. Deuk see the patient in the PACU? If the answer is yes, then you can discharge them whenever. Okay, I don't need to be asked. Well, you don't have to make sure every time, okay? That's the whole point. If you follow protocol, then we don't have to worry about it. I need your help. You grab it there. No, other side, other side, other side. No, other side. Yes. There. Yeah, if you can keep an eye on that, it'd be helpful. All right. Henry,
Yes, sir.
would you like to... Oh, so she's working on processing?
I have getting ready for the next one.
That's fine. So where's the next one going? Here, right?
Be over here. It's not
Yeah.
We're staying here today.
Yeah, that's fine.
We stay over here.
I'm happy with staying here. I mean, the last two cases are
Yes, simple.
quick ones.
Yeah, yeah.
So, Henry, if you
Yes.
have questions, you can ask me. Otherwise, let's run them through our videos for education.
Copy that. No current questions, but we do have a comment coming from Robin on YouTube saying, good live broadcast. Happy Father's Day, Dr. Deuk, and to your team of dads.
Thank you. Thank you so much. We appreciate that. All right. So we are here at the back of the C5-C7 disc in this patient. And you can see the herniation. It's blue. The bone spurs are pretty good size. Remember, we're not here to get rid of all the bone spurs. Just not possible. Nobody can get rid of all the bone spurs. So if we can't get rid of all the bone spurs, what do we get rid of? Well, you get rid of the ones that are actually causing problems. So which ones are those? Ah, that's a great question. That's for me to decide. I use basically my field of view to make that determination. They are the ones right here. Because this area that I'm working on is where the herniation is. This is the site of the herniation. It's the back of the disc. That's where herniations happen, back of the disc. And I know we don't talk too much about it, but there's not many places you can get a herniation. You can only get a herniation in the back of the disc or through what's called the vertebral end plate. And the ones that go through the vertebral end plates are called Schmorl's nodes, and they don't do anything to hurt the patient, so we leave those alone. We don't mess with them. I don't believe in treating things that don't cause problems for patients. So the ones that actually cause problems are the ones directly behind the disc, right behind the tear. And this is the tear. We're cleaning the tear right now. It's got all this schmutz in here. This shouldn't be here. This should be an empty space. And now, but instead you've got this herniation that I'm cleaning out, and you've got scar tissue here. You can see the PLL fibers, posterior longitudinal ligament. You got a little bit of bone spur, but that's not even on the spinal cord or nerve. Everything okay, Berndes?
Yep, everything's good.
That's fine. I didn't know if you were talking to me or somebody else. All right, any questions?
At this moment, no current questions.
All right. So maybe you can show our videos then?
Yes, sir.
All right, welcome back. That was a quick video. A lot quicker with the new ones, huh?
Yes, indeed.
So you guys can see the movement. If you look carefully, you can see the bones moving back there. That's what we want. We want to preserve movement. Our surgery does not take that movement away. If you do a fusion, on the other hand, patients lose that movement. And we don't want to take people's movement away at a disc, because if you lose movement at one disc, it puts a lot of stress on the other disc. And then the other discs wear out and you get what's called adjacent segment disease. So really, so far going well. That, again, the blue you're seeing back there is posterior ligament. And it's actually white, but it's covered in some blue dye that we put in. But I don't see much in the way of herniation left here. Not sure why. There's a piece of herniation there, which we'll get. Oh, that's a good one. Oh yeah, look at that thing, like a little fish, you know, trying to get away from us. Doesn't want to come out. So that thing is smooth, it's long. It's been there for a while, you can tell, because it's so smooth. Here it comes. Just took it out. And the reason it's smooth is her body has been attacking it. So it's kind of like throwing a rock in a river. After a few years, you take it out and it's smooth. It's not rough anymore. It's because it's been basically scraped upon and tumbled, and all the edges have been smoothed out by rubbing against other rocks or sand, debris. So that's what's happening. It's not getting tumbled back here, but it's being attacked by the inflammatory system. And the inflammatory system always uses enzymes, proteolytic enzymes, to attack things. Just about done with this one. Now, this is 5-6, right? So we're going to have to go down one. 6-7, correct? So that's going to be the challenging moment of the surgery, is getting down to the next disc, which I expect to be able to do. I just don't see really any herniation left in here. I'm going to just pull back and look a little more to the side. There's a piece. Gotta say, this is one of the I'm surprised there's not more scarred up herniation back here. I'm just wondering if maybe her symptoms are coming from a more recent herniation rather than old. Maybe they're more from the 6-7 rather than the 5-6. They both needed to be fixed. No doubt about that. All right, any questions?
At this moment, no current questions.
Okay. Well, I'm very happy with the progress. Now, she is traveling here from where? Texas. Do we know where in Texas this young lady is from? That's a bone spur, by the way.
Tyler, Texas.
Tyler, Texas. All right. Yeah, Tyler. Everyone's heard of Tyler. Looking good. We get a lot of patients from Texas. If I had to say one state that has the most patients besides Florida is Texas. Wouldn't you guys agree? Yeah, where else? California has a lot, but not as much as Texas. And obviously Georgia, right? Get a lot. Carolinas. This may be another piece right here. Yeah, I think we got to get this guy out as well. Just about done with this one disc. Just floating out a few pieces of herniation. Where else? Had a couple from Arizona, New Mexico, Seattle, Oregon, Kansas we just did, and Ohio. We get a lot from Ohio.
Yeah.
A lot of people from Ohio. Where else? Had a couple from DC, but not many. Chicago.
We get a few from New York, right?
New York, yeah. All right. Well, I mean, things are looking pretty good back here.
Lights on, please. Come out.
Let's do irrigation.
You want to irrigate or just
Irrigate. I want to get any loose fragments out. All right, so at this point, we're done with the first disc, folks. We're going to move on to number 2. And I'm just squeezing some juice down there to see if I can't. There's no suction on this tube, guys. Come on.
suction, please?
Why are we switching? I mean, do we not have 2 suctions? So why would we have to switch? Huh? Oh. It was full and it wasn't sucking? Really? That quick? Got it. Well, sounds good. All right. We're going to do the Deuk slide. The Deuk spine slide, where we slide down to the next disc. So we're going to need a little help. Let's keep everything sterile. You'll take the arms, you'll take the head. Jordan's got the fluoro, I've got the dilator, and Luis will get some of the shoulder if we need it. All right, 2, 3, 4, 5, 6. Everybody ready? Positions. Let's assume positions, and I'm going to get this tube out.
I can see it, right?
What?
Yeah, you can see it.
Yeah.
Yeah.
I can see it. Can we get it? That's the real question.
You're gonna get it.
Oh, all right. Very good, Jordan. So Let's give this a try. Coming out. Don't move too much. All right, we're out. Let's get an AP, make sure we're midline. Nobody move, everybody stay where you are. Count of 3, Jordan. 1, 2, 3. Perfect. Go lateral. So I'm happy we're still in the center of the spine on the front back view. That's where we want to be. You don't want to get too far off to the side. Now, I got to climb this little mountain here, like little Mount Vesuvius. Do they have any mountains in Tyler, Texas? All right, perfect. AP, don't move, you guys, don't give up. I need to verify we're in the center. Shot. Yep, perfect. Well, if there's a little mountain in Tyler, Texas, this is it. This is the mountain. Shot. You guys see that little peak there, and we got a little bird's mouth. Shot.
Yes, we do.
All right, going in. Shot. You know, they say it's better to be lucky than good, and I agree. I'm going to try another discogram. It's a pretty collapsed disc. Everyone agree we're at 6-7? That's our second disc, correct? Shot? 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 Trying to clean the schmutz out from the end there. Shot? A little more. Now? Yeah, I think we got it. I think we cleaned it out. Shot? Oh, yeah. That was for you, Luis. Just to trick you. A little distraction would be so nice, Dr. B, if you're able to do it. Shot? All right. Oh yeah, it's opening up nice. Look at that. Beautiful. Shot? We're going to get this. Almost there. That's it. Good. All right. Everybody do your part. We're almost done. You guys are doing awesome. I got to get this in. I think we've got this. All right. You guys ready? Luis, do your special thing with the chin. Shot. I think, right, Luis?
Yeah,
Doesn't that help?
with this.
Here it goes. Yeah, Berndes can feel it. He's got the Midas touch. Or at least the sliding surgical steel touch. Is that it there, Jordan? All right. Shot. And again, little pull. Almost done. I think that's it. That's perfect, guys. Thanks so much. You did a great. We are at the back of that disc. So if there's a herniation back there, we're going to see it. We're going to get it out. She didn't make it easy. You can actually see the clavicle right here. She's right up against the clavicle. I'll get that. Any questions, Henry?
Yes, we have 2 questions. This next one coming from Tracy on YouTube.
Hello, Tracy.
Asking, curious, how often do you see double crush syndrome?
Not often. It's overdiagnosed unnecessarily, Tracy. It's somebody is trying to convince Tracy to do spine fusion, and they're giving her some nonsense diagnosis probably. I don't really know, Tracy, but I'd have to see it myself to believe it. It's amazing some of the things patients are told to convince them to have fusion done.
Thank you.
It's a fair question, Tracy. Good news is it's very rare. And you probably don't have it, Tracy. All right. What we do have, though, is bone spurs. Look at all that. And look at that herniation wiggling around there. You see it right there?
Yes, we do.
Boom, here it comes. Just got it out. See how the herniations are really small pieces. They're not big. Remember, this laser fiber's half a millimeter. There's another one. Come on out. Half a millimeter. And we all think of a herniation as being, you know, one big herniation, but it's not. It's actually about 20, 30 sometimes more pieces that have pushed out over years and years and years of activity. Okay? So don't think that a herniation's a one-time event, because it isn't. It's, you can count on one hand in my entire career, 27 years neurosurgery, that I've seen herniation be a one big event, one big herniation, that's it. All right, watch that. Making some good progress. What do we got here? How are we doing, Bernadez? Okay?
We have another question.
Uh-huh.
This comes from Walter on YouTube,
Hi, Walter.
saying, I was just evaluated by a spine surgeon where I live. He said he could not do anything for me due to arthritis growing into my spinal column. I did hear you say that you could remove hard material.
Yeah. Yeah, Walter, you need to do an MRI review. Okay? Once you've done an MRI review with me, I'll tell you exactly what's wrong and what we can do to fix it. Right now, I am... Did we just change irrigation or something? What happened to irrigation? It stopped, or it's good? All right. These are bone spurs here. This is arthritis. You're looking at arthritis. A lot of this right here is scar tissue. All right, the herniations have come out. They were little ones. They just created a lot of scar tissue in this patient. Now, I don't normally remove too much scar tissue, but I'm not seeing much else right now. We've gotten most of it. But to answer your question, what's wrong and can we fix it? Yes, we can fix it. I just need to know exactly what's wrong. To do that, I have to see your MRI. I got to do an exam. I got to check you out face to face. Do an assessment. Flip it. All right, we are done in 5 minutes or less, Dr. B. Folks, our next case is going to be a lumbar patient who traveled here from, I want to say Jacksonville. Yeah, he's a local boy. Jacksonville. We got a Floridian today. And yeah, he's got a lot going on. I think he has like 3 spots on his disc, right? And then some facets, maybe. Piriformis. All right. I'm pretty sure we are doing a piriformis. About 90% sure. You want to check into that?
We were told no. Okay.
All right, well, I don't know. It was on the consent, so we need to look into it. have Remy come to the pre-op area. Okay? Have her meet me there now. Give Remy a call. We got to straighten it out. Thought we had already straightened it out. Alrighty then. We're just about done. There's a piece right there. See that?
Yes, we do.
Oh yeah, come on, baby. So her herniations, honestly, I think they're not that big, and I think really they caused just a lot of inflammation in her case. She just responded differently than most people. She really responded aggressively from an inflammatory standpoint. But
Could be her Sjogren's disease too.
yeah,
You post on that?
yeah. I forgot she does have
That's
Sjogren's.
my diagnosis.
Yeah. Clearly, yeah, she is hyperinflamed. All right, we're done here. I think right there. Yeah. Just let me take one more peek this way. All right, well, let's hope this does the trick for this nice lady.
Thank you. Sit in on, please. Thank you. Stop off. Thank you.
And if there's no questions, Henry, you can wrap our surgery up.
Copy that.